I'm going to talk to you today about oncology research in different healthcare systems like Canada and the United States. We want to know which healthcare, Canada or United States, is better in oncology research. For starters, it is important to understand the differences and similarities between Canada's and America's healthcare services before even determining the benefits it may have in oncology. America's healthcare system has changed slightly since President Obama came into office. The policy known as Affordable Care Act. Affordable Care Act requires all citizens to have basic healthcare insurance or face penalties such as fines. While in Canada, the main focus is universality, which is created by giving the same coverage to all citizens by the government. In comparison, America has tiers of different health insurances that cover more expenses as the monthly payment increases. Canadians, of course, still pay a copay, but the copay is not a surprisingly large bill, unlike America. This class system of healthcare isn't present in Canada, which is what mainly makes the bulk of difference between both countries. Canada's healthcare system seems great, right? Low copays, universal coverage, and no pesky limits. How could it possibly be flawed? Contradictory to belief, Canadians are only promised hospital and physician services under the federal government, but supplementary benefits are determined by province. In fact, Sarah Cliff says, about 2/3 of Canadians take out private supplemental insurance policies or have an employer-sponsored plan to cover these services. These supplemental costs are things like dental insurance and drug coverage, and in all provinces, these expenses were either paid out of pocket or by an employer. Similar to Canada's supplementary benefits, citizens of the United States have to pay for dental insurance, separate from their health insurance, and pay higher expenses in order to get coverage on the other benefits. With the introduction of Affordable Care Act, America's healthcare system is very similar to Canada's, but differences lie in the advancements of cancer research and treatment. Looking in the case of cancer, Canada's healthcare system seems to be lagging compared to the United States. While the class system of healthcare present in America can seem unfair, it allows patients to have a wide variety of anti-cancer treatments and drugs available. Between 2003 and 2011, 33 new cancer drugs were developed. Out of those 33, 30 were approved by America, and 24 were approved in Canada. But because of Canada's equal health care, only 3 of these drugs were actually covered and available to the public. 7 others were available, but were only covered in certain parts of Canada. America was able to administer all 30 cancer drugs, and the availability was based off healthcare coverage rather than location, says Nigel Ronson. Time is also an issue Canada faces, because the government administers all the treatments. It has to be affordable to them to administer on a large scale. The ability to approve and then administer the specific anti-cancer drugs between 2003 and 2011 took 174 days longer than the United States, says Nigel Ronson. Unfortunately, these drugs in Canada can be approved and sold, but may not be available to the patient depending on which province they live in, even if they can afford it. Unfortunately, cancer is a very time-sensitive disease. Depending on the cancer, it can spread quickly and very silently. The government providing all equal health care makes waiting lists long. Since each patient's health care is provided by the government, specialists aren't paid as heavily, causing shortages of healthcare workers and ultimately long waits. On average, Canadian cancer patients waited at least 3.5 weeks before their radiation treatment began in 2013. 3.5 weeks is a time frame that someone with stage 4 brain cancer may not have. Unfortunately, one major similarity in cancer treatment between both countries remains the same: the disapproval of effective cancer drugs. Each country has discovered cancer treatments that would eliminate cancer without harming the patient. In Canada, dichloroacetate, or DCA, has been found to trigger the mitochondria to fight back cancer cells. For years, scientists have been looking at the gene sequences in the genome to solve the cure for cancer, which is the long way to do it. In the meantime of researchers poring over DNA sequences to spot mutations, other scientists believe that damage to the mitochondria allows for the production of malignant cells. the damage causes the mitochondria's inability to fight back. Drugs that rejuvenate damaged mitochondria have been in research for many years now. One in particular is called dichloroacetate, and as scientists hypothesize it activates the mitochondria, resulting in the body's natural ability to destroy cancer cells without harming any other cells. DCA has been effective on lung, brain, and breast cancer, which are all very aggressive forms of cancer. Sadly, this drug is overlooked by the media and pharmaceutical companies. The pharmaceutical companies overlook these inexpensive, non-patented drugs because they simply can't make a profit. Canada's healthcare system may be great for the trip to the hospital or for a broken bone, or when next month's paycheck hasn't come in and the flu is going around. But when it comes to advancement in oncology, it lags. The excessive wait times and difficulty approving new drugs will only let cancer continue its rampage. The disease itself works quickly, reproducing infected cells rapidly until it spreads throughout the body. The cure for cancer will one day come, but it will take many attempts, trials, and falls. In order to do this, a country needs to have fast approval rates, limited wait lists, and as many possible cures and treatments available to the public. While America's healthcare system may seem unfair, it allows American citizens to receive new, innovative drugs and treatments for cancer at the fastest available moment. With speed, groundbreaking research, and a wide availability, the disease that strikes fear into millions everywhere can and will be eliminated.